talk about vaccines. 3 days ago, the FDA, they announced that they will be adding a warning to the Moderna and Pfizer COVID vaccines, informing consumers that there is a risk of developing heart inflammation. Now, this decision came after the CDC, which stands for the Centers for Disease Control, after they reported that more cases of heart inflammation, which includes either myocarditis or pericarditis, were found among young adults as well as children after they received the vaccines. In a statement released by the FDA, which is right here, I have it in my hands, they said that they will be adding some revisions to their vaccine fact sheets about, quote, the increased risks of myocarditis, inflammation of the heart muscle, and pericarditis, inflammation of the tissue surrounding the heart following vaccination. Furthermore, it says that there may be an increased risks, particularly following the second dose and with the onset of symptoms within a few days after vaccination. Now, it's worth noting that this warning only applies to the Moderna and Pfizer vaccines, which use mRNA technology and require 2 doses. However, the Johnson & Johnson vaccine, which uses an adenovirus and only requires 1 dose, is not included in this new warning. Also, the FDA Commissioner, Dr. Janet Woodcock, she released a statement arguing that the risks of developing heart inflammation are outweighed by the benefits of the vaccine. Here's what she said as a part of her statement. The risk of myocarditis and pericarditis appears to be very low given the number of vaccine doses that have been administered. The benefits of COVID-19 vaccination continue to outweigh the risks, given the risk of COVID-19 diseases and related potentially severe complications. Now, in terms of the raw numbers, according to the latest findings from the CDC, which were released about a week ago, there have been over 1,200 cases of heart inflammation in individuals who are aged 30 years or younger after they received their vaccine doses. And based on the submissions to the Vaccine Adverse Event Reporting System, which is operated by both the FDA and the CDC, this rate of heart inflammation is higher than what was expected for young males. According to that data, for males between the ages of 12 and 17, the expected number of heart inflammation cases following their first vaccine dose were between 2 and 21. However, the observed number of heart inflammation cases was 32. And then, for males between the ages of 18 and 24, the expected number of cases were between 3 and 34. However, the observed number of cases was 47. Now, in terms of what the symptoms are, as well as what you should do if you're experiencing them, here's what the FDA said as a part of their statement. Quote, vaccine recipients should seek medical attention right away if they have chest pain, shortness of breath, or feelings of having a fast beating, fluttering, or pounding heart after vaccination.